Okay, so let's continue on with the nervous system. So we said that the conus medullaris and the end of the spinal cord ends at about L2, right? So L2 is where it ends. If I had something like, well, we'll talk about meninges and what they are there. Meninges. If I had something called meningitis, which means inflammation of the meninges, maybe due to a bacterial infection or a viral infection, the meninges is essentially the layers that help to cover and protect the spinal cord as well as the brain. And so there's fluid inside of it. And if I have a bacterial infection versus a viral infection, I want to determine why or which one I have so that I can treat better. Um, Spinal tap. Where would you puncture someone's lumbar in order to access the spinal cord, or not the spinal cord, but the fluid inside the space of the spinal cord? Well, would I want to do it at L1? No, if I do, I can hit the spinal cord and I can cause permanent paralysis, right? Or paraplegia, depending on which one. Not quadriplegics, but if you're low enough, you can damage the nerves going to the legs and essentially cause damage. So, no, that's out. Well, do I want to go L2? No, I might nick the end of the conus medullaris and the spinal cord and cause the same problems. What about L3? Yeah, it's cutting a little bit close, right? And depending on what age you're looking at, if you're looking at a child versus an adult, the child is going to be set a little bit lower because the child's still growing. Okay, L3 is out. L4, maybe I'm a little bit safer. So between the levels of L4 and L5, it's a pretty relatively safe place to do a spinal tap or a lumbar puncture. And why is that so? It's far enough away from the conus medullaris and the end of the spinal cord so you reduce the risk of injury. And because you have these spinal nerves inside of a fluid, as you puncture, hopefully the nerves will kind of be pushed to the side. So you'll have less likelihood of damaging. So that's where we would do a spinal tap. And why? Let's continue on. So spinal cord segments, we went over. We did this, right? We said ventral root was on the front or the back? Front, anterior or posterior? Anterior. Was it sensory motor? MEV. So it's motor, efferent, ventral. What about this? Dorsal. SAD, sensory, efferent, dorsal. Oops. MEV, motor, efferent, ventral, SAD, sensory, afferent, dorsal. And then dorsal root ganglia, a group of cell bodies outside the CNS, so inside the PNS. And they're for sensory or motor? For sensory. So you guys can review that. Just go over what I would suggest is, as much as possible, just do SAD, MEV, SAD, MEV, SAD, MEV. Ascending, up, sensory. Descending, down, motor. So we can practice that. Let's just practice it now. So if I have information going up to the brain, is that sensory or motor? It's sensory. So ascending is sensory, descending is motor. Ascending, sensory, descending, motor. So here's how it's going to get